Hello, I'm Dr. Suddhasattwa Sen, Senior Consultant in Charge, GI, HPB, Cancer and Surgery in AMRI Dhakuria. See, the one topic that has been given to me to discuss with you is very important. It's like, how do a patient, or how do we also as a patient, not just as a doctor, would choose a hospital and a doctor. Now, what is very important for a hospital is you have to base your choices based on your finances. That is very important. And also the disease. If your disease is big and critical, which would before you embark on the procedure, you may need a lot of finances. It is preferable that if you don't have a mediclaim, you choose a hospital within your limits. But then amongst the limits, you Google up, you take word of mouth feedbacks, you do your own research, and whenever you boil down to say 2, 3, 4 hospitals, then look at the location, look at the facility, look at the finances, and then you choose that hospital. If finances is not an issue, then probably it is better that you choose a corporate hospital. In corporate hospital, there are multiple options. You do not need to go out of state for these things, because most of the subjects you will get some good doctor in most of the corporate hospitals. Now, obviously, since being part of AMRI Dhakuria, I have worked with so many different hospitals as HOD and GI director in most of the corporate hospitals of Eastern India. I can tell you one thing, that AMRI Dhakuria is one of the best options to be chosen from the different options, but then all are good. So once you have decided to come to a hospital, how to choose a doctor? There are 2 ways to choose a doctor. You can choose a doctor on your own and then choose the hospital as per the doctor, or you can choose the hospital and then come down and look at the different options, do your research, do your Google searches, and then choose a doctor accordingly. Now, coming to choosing a doctor, there are few criteria that you must see. What is your problem? Once you know your problem, say I'm a GI surgeon, so you have a problem inside the abdomen. How do you choose a doctor? You first, the most important thing is look at the qualifications of the doctor. Once you give, say, gallbladder problem, your cancer problem, you search on Google, Google will give you different names. Go to the feedbacks, read the feedback, see the stars. Because the feedback, there are 2 ways of writing a feedback. One is just 1, 2, 3 liners, he's God, he's that. So these may not be adequate. But if it's a long feedback, when actually patients have written details of their cases and how they have recovered and how good the doctor is, that is a positive feedback. So study both the positive and the negative feedbacks of all the first 10, 20 doctors. Most important, second point is look at the qualifications of a doctor. Third is whether amongst these qualifications, whether he's a gold medalist or not. What are his outcomes? Look at the website of the doctors, look at the website of the hospital, and apart from that, do your research with known people, known patients, whatever. So once you know that this is the doctor you have chosen based on qualification, once you come to the doctor, look at the behavior, the way he carries himself, the confidence. At the same time, also look at this, that ask all questions and how pertinently the doctor can answer your questions without getting irritated. If the doctor can answer all your questions to your satisfaction, that is the best time to probably choose this doctor. There are many other ways you can decide. Finances is the last of it. Focus on the quality and not the guys with quantity. So that in a very nutshell is how to choose a doctor and a hospital.